Angelica Simmons-Wade, Sāng Jú Yǐn, Spurbs.
Welcome to Spurbs Herbs, episode 90. Today we're going to be talking about a Chinese herbal formula, Sāng Jú Yǐn, mulberry leaf, and chrysanthemum drink. So there's a lot to cover. Let's get into it. As I mentioned today, we will be looking at another Chinese herbal formula, Sāng Jú Yǐn. That's Sāng Jú Yǐn, or mulberry leaf and chrysanthemum drink. So if that sounds weird as I'm pronouncing Sāng Jú Yǐn, it's because I'm using the tones and I'm not a native speaker. So while I've had several years of Chinese, I'm not a good speaker of it. So I may be exaggerating the tones a little bit, but that's why we do that with the Chinese. Anyways, Sāng Jú Yǐn is from the formulas that release exterior wind heat subcategory of the formulas that release the exterior category. We've been doing a lot of these lately because I want to put some packages together on these sort of things on the exterior herbs. And so we do a few and then we go somewhere else, we come back. It is a useful formula for treating early stage colds with a cough. That is sort of its raison d'etre. That cough is really important. As always, we'll do our deep dive into this herb formula and look at its traditional uses and its preparation, interactions, and cautions. And as usual, we will be adding something a little different. We're going to introduce the concept of mandatory reporting. So that's an interesting one. We haven't done that before. It's going to be another interesting vacation into the exciting continent of herbs. Please join us. Before we get into that, I just wanted to mention that I've been teaching for quite a while now on a wide variety of topics. If you like this podcast, honestly, if you don't like this podcast and you still want to explore more of my courses, they are available at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org, and include a ton of different topics, including my drug herb series, looking at drugs and how they interact with herbs and vice versa, several ethics and safety courses. We're going to talk about those in just a minute. Chinese medical research, several treatment of condition courses such as arthritis, neck and back pain, COVID, and depression and anxiety. And one of my favorite courses, the Chinese Herbal First Aid Kit. And they are all at a reasonable cost, and you can get an additional 20% off with the code SH20OFF, OFF. That's SH as in Spurbs Herbs, 20 off. So that is how you can get 20% off of all those courses, and they're already reasonably priced. So let's talk a little bit about ethics. So a few weeks ago, as I'm preparing this podcast, the California Acupuncture Board, so all of you who are California acupuncturists, this pertains to you, started requiring 4 hours of law and ethics continuing education every 2 years. The National Certification Commission for Acupuncture and Oriental Medicine, the NCCOM, or quote unquote national boards, requires 2 hours of ethics professional development activities every 4 years. So in other words, ethics are required pretty much across the US. In light of this, I thought I would look at a 1 hour course I developed to help satisfy these requirements: protecting your patients, mandatory reporting. For what we are doing today, discussing mandatory reporting, we are violating some core ethical principles while supporting others. The underlying principle underscoring mandatory reporting is the idea that there are certain members of our society that are more vulnerable and they need to be protected by society. And this protection of the vulnerable is more important than other potential ethical concerns. Privacy. Privacy is the main ethical principle we are violating when we report something to authorities. Privacy is a fundamental right of patients. It is crucial for building trust. If a patient does not believe what he or she is saying is private, they will not divulge adequate information to diagnose and treat. So therefore, we can't do our job or we can't do our job effectively. Autonomy is a different ethical principle and is the right of an individual to make their own decisions. This principle refers to an individual's ability to decide what treatments to undergo and which ones to avoid. Autonomy is the principle that allows a person of a particular religious faith or other reason to refuse a blood transfusion, a medication, or any medical interventions whatsoever. And informed consent is a cornerstone to a patient's autonomy. If a patient doesn't know, in other words, they're not informed, how can they make an informed decision? So they can't actually practice their autonomy. And the third ethical principle that we want to mention here is beneficence. Beneficence is the principle of doing good, demonstrating kindness, and showing compassion. Basically, it means helping others. And many medical controversies are based on a conflict between beneficence and other ethical principles. So now we can talk about mandatory reporting with those under our belt a little bit. So mandatory reporting violates a patient's right to privacy in order to be beneficent to a vulnerable member of our society. So that's the key here. We're violating someone's privacy. That's key, because if we're going to do mandatory reporting, we are going to be violating some of their own uh, 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 the requirements. Their own. We're going to be violating our ethics of privacy and violating their privacy, their own ability to be private. But in order to be beneficent to a vulnerable member of our society. And this is obvious in the case of abuse, that if someone is coming to us and reporting abuse, or so they're saying they're being abused, then they are intending that to be private between the person being abused and us as a professional. However, that is it, we are mandated more often, we'll talk about that in just a second, to violate that privacy in order to help them. So part of the abuse, of course, is that they want to keep it quiet. They don't want it to know, and that actually extends the abuse. So that's why it's important in this scenario. There's another major area of mandatory reporting. There's a couple others, but this is another one, is in the case of a communicable disease. We're protecting someone who is still vulnerable in that they are ignorant of the risk and are not able to properly exercise their autonomy and act with informed consent. So I think an obvious way this can happen is in sexually transmitted infections or diseases, where they're not being given the choice to not have sex or to have sex. They're not being told that there's a communicable disease involved. But it also is in a lot of other communicable diseases. What's interesting is one of those communicable diseases has sort of a special category, which is HIV, human immunovirus. In some ways, you cannot report that. Again, we're going to get into the broad terms, some of the laws around this, but a lot of communicable diseases you are necessary to report if you're the one diagnosing it, which as acupuncturists and herbalists, we're probably not the ones to diagnose these things. But if we were, we have to report them if we're a mandatory reporter. So let's get to that. The first question a practitioner needs to ask is whether they are mandatory reporters. And even if you're not a practitioner, this information is useful to you because it explains, like, if you say something to your practitioner, there are certain things that practitioner must report. So the first question is a practitioner a mandatory reporter? And states and countries may, and even counties to a certain extent, may have different laws on this matter. In California, where I'm at, we are considered medical practitioners and therefore mandatory reporters. Absolutely, we are mandatory reporters in California. Other states may or may not have similar laws. A lot of them do, but they may not have similar laws, or they may say we are reporters for certain situations, but not others. So in other words, in the case of abuse, we might be a mandatory reporter, but in the case of communicable diseases, we might not be a mandatory reporter. Again, this is a state-by-state sort of scenario. And I know in California, even some of the communicable diseases can change from county to county that we need to report. So it's very specific to where you're at. And of course, just a few minutes here is not enough time to get into all of that. However, whether or not it is mandatory, it may still be ethical. And a practitioner should consider reporting any cases that would fall under our discussion today. And we're going to talk about that in just a second. So first, what should be mandatory reported? So many diseases must be reported in order to protect population safety. These are generally communicable and or have an unusual risk for society. We talked about communicable diseases, but there are other diseases. So for example, certain types of cancer are reportable. And the reason why is because there are environmental hazards that might cause those cancers. And if they didn't know that these cancers are happening, they wouldn't know to investigate the environmental hazards. So it's important to report those. So it can be communicable or unusual risk for society. In most states, both elder abuse and child abuse must be reported to authorities. And other vulnerable populations may also have mandatory reporting requirements. This may include the abuse and neglect of mentally or physically disabled individuals. And it is also, in most places, it is mandatory to report a patient who is in imminent danger of harm to self or others. And often domestic violence is reportable. So again, that's a state-by-state thing. In California, when I first wrote this course, domestic violence was not reportable. Then they did a law, and now it's a mandated reporting. So depending on where you're at, you may have to do you report any of these things that may happen. And I'm sure there may be other issues too, but those are the common ones. So this was a brief introduction to mandatory reporting. That's all we can do here. And like I said, I have a whole 1 hour on this course, so there's a lot more to get into. But in general, most localities will protect reporters from any liabilities of reporting that were done with good faith. And that's the key component. If you report with good faith, then you should be protected. And what does that mean? That means not bad faith. So if, let's say, one of your patients doesn't pay you and you're going to get them back, that would be bad faith. That would not be, and if you reported something because of that as revenge, then you would not be protected from any liabilities. But if you truly believe that what's happening is happening, or even if you just suspect it, and believe me, I've done this multiple times now. I used to run one of the largest the largest clinics, acupuncture clinics in the country, and I've been involved in several mandatory reporting. It's not bad. They're not out there, it's not hard at all. It's, of course, always a little bit of a jingly as you call in, but they're very nice. Everyone I've ever talked to has been very nice. They do not have a presumption of guilt. They ask questions. They make their own determinations as to whether they're going to pursue it or not. You may or may, usually they try to prevent your name from coming out, but that isn't always the case. Sometimes, especially if it goes to a court or something, you might be called on as a witness or what have you. And I can tell you, I'm really, really, really happy. I mean, one time I did it, I was, it was early in my career. I overstepped, and they just told me that. It was fine. The other one was, I wasn't even sure I should call or not because it was just a suspicion, and it was for elder abuse. And it turns out there was elder abuse, and the person doing it was prosecuted and actually had lots of problems. And we protected the person, the elderly person that was involved with that. So I feel really good about that mandatory reporting. The end was quite a positive result for the person, our patient, not the person who was abusing, of course. So if you do it with good faith, there aren't any liabilities, but there can be consequences of not reporting when mandated, including being sued and sanctions against one's license. So if you think you should report. They will tell you whether or not it should be followed up or not. They're the ones who will be doing the following up, not you, but you've done your job as reporting. But if you don't report when you should report, there can be consequences. Again, depending on where you're at. And of course, there is a lot more to know. And if you're interested, please check out my course, Protecting Your Patients, Mandatory Reporting, at www.integrativemedicinecouncil.org. And as we mentioned earlier, if you use that SH20 off code, you get 20% off this course. So that's a good thing. A lot of good information and relatively inexpensive, very inexpensive. With that little something different under our belts, let's talk about today's formula. Today we're talking about Sāng Jú Yǐn, or mulberry leaf and chrysanthemum drink. Other names include Sāng Jú Yǐn, so with a CHU rather than a JU, Morris leaves and chrysanthemum drink, mulberry and chrysanthemum decoction rather than drink, and Morris and chrysanthemum combination. It's all kind of themes on the same, I mean, variations on the same theme. This formula is in the subcategory of formulas that release the exterior wind heat under the category of formulas that release the exterior. This is from one of our textbooks, Scheid. We have when we talk about formulas, we have two major textbooks that we look at. One is Scheid and his team, which I don't have here, but I know Bensky's involved in that one as well. Scheid and his team. And then our other usual formulas textbook, Chinese Medical Herbal Formulas and Applications, Pharmacological Effects and Clinical Research by Chen and Chen, says it is in the acrid and cold exterior releasing formulas subcategory under the exterior releasing formulas category. They basically say the same thing, but from slightly different perspectives. One is from the perspective of the herbs. So the herbs are releasing wind heat, and the other one is well, I don't know how the perspective, one is acrid and cold releasing, and one is, oh, interesting. I think that's right. They release exterior wind cold under the category, so they let it go. Anyways, I'm actually confusing it with when it comes to their individual herbs in the two textbooks. They're a little bit different, but these are all the same. So this is release exterior wind cold from. That's what it is. It's it is acrid and cold exterior releasing formula. So it helps cold and it helps wind is the bottom line. So let's talk about these formulas that release the exterior. As we discussed in several previous episodes, Scheid et al. Described the overall category in the following way. When a pathogenic influence first penetrates the body, it tends to cause a disorder of the exterior. In this context, the term exterior, biao, denotes the superficial layers of the body comprised of the skin and muscles. These are perfused by the body's protective qi, which is fierce and hot in nature, and whose task it is to warm and defend against penetration into the body by external pathogens. If a pathogenic influence lodges in the aspect of the body, it not only obstructs the normal physiological diffusion of qi and fluids there, but encourages the body to move more protective qi toward the exterior in an attempt to push out the invading pathogen. For this reason, exterior disorders are characterized by fever and chills, indicating obstruction of normal physiological warming, even as protective yang in the exterior tends towards excess. Head and body aches, indicating obstruction of qi and fluids in the most yang, i.e. exterior portions of the body, and a floating pulse, indicating the movement of protective yang toward the exterior. Since wind is the vehicle by which other external pathogenic influences enter the body via the exterior, it is involved in most exterior disorders, especially those involving cold and heat. Thus, it is said that wind is the leader of the 100 diseases, Feng Wei Bai Bing Zhi Zhang. The symptoms associated with an exterior disorder indicate that the body is actively trying to overcome obstruction of the qi dynamic by one or more of the 6 pathogenic influences. Treatment in Chinese medicine seeks to support these physiological reactions through strategies that release the pathogenic influence from the exterior, also known as jie biao. For this purpose, one deploys light, acrid, moving herbs that unblock obstruction, diffuse the protective qi, and decimate fluids to vent pathogenic influences back toward the outside. No other strategy will prevent the pathogenic influence from penetrating more deeply into the body. Often, but not always, this results in sweating. This type of sweating indicates that an obstruction has been overcome and that the qi and fluids can once again stream to the surface of the body. Like the flow of water that breaks through a dam, the sweating may initially be pronounced, especially if a very acrid and warming formula is used. However, the profuse sweating should quickly abate as the body finds its physiological balance. For this reason, releasing the exterior is often equated with inducing sweating. Yet, in many contexts where formulas to release the exterior are used, the sweating may hardly be noticeable, or strong pathological sweating may evolve into a milder physiological sweat. This is because the ultimate goal of these formulas is not to promote sweating, but to unblock and restore the order to the flow of qi and fluids. The term release from the exterior was first described in chapter 5 of Basic Questions. It's Basic Questions is referring to the Huangdi Neijing Su Wen, the Yellow Emperor's classic of internal medicine, Basic Questions. So this is a part of that book, the oldest existing book on Chinese herbal medicine, and it was written about 200 years BCE. So chapter 5 says, if a person harbors a pathogen, the body becomes soaked as the movement of protective qi to the exterior transforms fluids into sweat. Hence, when the pathogen is at the level of the skin, use sweating to discharge it. The first known text to list herbal formulas that embody this strategy is the early 3rd century work, Discussion of Cold Damage, which provides some of the most influential formulas in this category, such as ephedra decoction Pa Wang Tong, cinnamon twig decoction Guizhi Tong, and their variants. Its focus on acrid, warming herbs to overcome obstruction from wind, cold, and dampness dominated medical practice until the Jin Yuan dynasties of the 12th to 14th centuries. Innovation until then consisted of extending the range of substances used to promote sweating rather than seeking new areas of application. This changed in the 12th century with Liao Wansu's focus on heat pathogens, which led to the idea that heat in the exterior can occur there directly rather than being due to constraint caused by the cold. This is called the Wenbing or the warm disease theory, school or theory. Venting such heat requires the use of acrid cooling substances which do not necessarily promote noticeable sweating. The treatment strategies and formulas composed by 17th and 18th century physicians like Ye Tianshi and Wu Ju Tang are associated with the warm pathogen current, are most emblematic of this approach. Other innovations stemming from the Jin Yuan era are the combination of exterior venting with tonifying herbs to treat exterior excess combined with deficiency of qi, blood, or fluids in the interior, and the use of herbs to dispel pathogens from specific channels and their associated surface regions. Sweating is the first of the 8 methods of treatment formulated by the 18th century physician Cheng Guopeng, underlying its importance in clinical practice. Yet many practitioners continue to underrate this method. This is unfortunate because the odds of preventing the development of a serious condition are always better when intervention occurs at the early stage of an illness. It is best to treat diseases at the level of the skin and hair. The next best is to treat them at the level of the muscles and flesh. The next best is to treat them at the level of the sinews and vessels. The next best is to treat them at the level of the 6 yang organs. The next best is to treat them at the level of the 5 yin organs. When treating at the level of the 5 yin organs, half the patients die and the other half survive. And this is also from Basic Questions, Chapter 5, the Huangdi Neijing Su Wen, Chapter 5. Successful use of the formulas discussed in this category will be aided by paying attention to the following principles. First, accurate diagnosis is essential. If an interior disorder develops before the exterior has been released, the practitioner must choose between releasing the exterior first or treating the exterior and interior simultaneously. The formulas in this chapter are inappropriate for treating disorders solely of the interior, express rashes, or edema due to deficiency. Likewise, it is important to be clear about the precise nature of the pathogenic influence to be released. as this determines the choice of formula. One must also be cognizant of the type of sweating to expect from a particular formula. So that was the first principle. Second, most of these formulas should be cooked briefly. They treat acute disorders and are prepared as decoctions or powders. They contain substances that are light and volatile in nature, which, if subjected to too much heat, lose their efficacy. Third, formulas taken hot after meals will provide the best results. Sweating is further encouraged by instructing the patient to bundle up after taking the medicine. As the goal of sweating is not sweating itself, but to assist the function of the protective qi, only a slight sweat over the entire body is needed to release the exterior. Excessive sweating dissipates the qi and fluids. Fourth, the formula and dosage should be adjusted to the individual's constitution, local climate, and season. For example, a person who sweats easily, lives in a warm climate, and contracts an illness during the spring or summer requires only mild treatment. On the other hand, a person who does not sweat easily, lives in a cold climate, and contracts an illness in the autumn or winter requires stronger treatment. So let's talk about formulas that release exterior wind heat. So Scheid continues to describe this subcategory. Externally contracted wind heat disorders are characterized by fever, sweating, a slight aversion to wind or slight chills, headache, thirst, and sore throat. There may also be a cough or redness of the eyes. The tongue coating is white or slightly yellow, indicating that the heat has not penetrated deeply enough to cause a purely yellow coating. And the tip of the tongue might be maybe slightly red, indicating that heat is already entering and damaging the fluids. The pulse tends to be floating and rapid. Among the four-level differentiation of the patterns of disease, which is from that warm disease theory that we were talking about, so the four-level differentiation of the patterns of disease, this presentation corresponds to the protective level, which is the most superficial. The core ingredients for these formulas are light, acrid, and cooling herbs that release the exterior, such as morifolium, sangye, chrysanthemum, floss, juhua. Both of those are in our formula, including our next one, menthe, haplocalicis herba or boha, that's field mint, and arctii fructus neobangza. Because warm heat pathogen diseases can develop suddenly and quickly enter the deeper levels of the body, these formulas commonly include herbs that clear heat, such as Linicerae floss or Jinyanhua, Forsythia fructus, Lian Chao, that's in our formula today, and Lophotheri herba Danjuye to interrupt this process. These diseases first attack the lungs and disrupt its disseminating and descending functions. So the formulas often contain herbs that treat these problems, such as Platycody radix Jaegong and Armeniaceae Semen Xingren, and our formula does as well here. Warm pathogens also have a tendency to injure the fluids, and herbs that generate fluids and also clear heat, such as Trichosanthes radix Tian Hua Fen and Phragmites rhizoma Lu Gen, which is in our formula today, are therefore frequently used in formulas to release exterior wind heat. So there you go. That's a good overview of the category. And you can see that already a lot of what this talks about in general, we're going to be looking at specifically for this formula. So what are the Chinese medical actions of this formula? Scheid et al. Say this formula disperses wind and clears heat, stops coughing by facilitating the flow of lung qi. It's that coughing symptom that sets this formula apart from other dispersed wind, heat, clear heat, dispersed wind and clear heat formulas. So that is sort of the key symptom for this formula. Chen say it dispels wind and clears heat and ventilates the lung and arrests coughing. I love the word choices sometimes. So what are the Chinese medical indications for this formula? So Scheid et al. Say this formula can be used for slight fever, cough, slight thirst, a thin white tongue coating, and a floating rapid pulse. This is the early superficial stage of a warm pathogen disease. This type of disorder enters through the nose and mouth and thus most readily damages the lungs. In the initial stages, the pathogen penetrates and obstructs the collaterals of the lungs, inhibiting its clarifying and descending function. Coughing is thus the main symptom. Mild fever and slight thirst reflect the presence of mild exterior heat. The floating rapid pulse also reflects exterior heat. The normal tongue coating indicates that the condition is still in the exterior. So for me in the past, I've used this formula. This is one of those formulas. There's like 3 or 4 formulas you use when someone's just getting a cold, to kind of prevent the cold from getting any worse and to treat it. This is one of those formulas. And again, that key symptom is that cough. So if you have someone who's starting to come down with a cold and they have a cough, this is definitely one of those choices. You do want to check that it's a bit on the heat side of things rather than the cold side of things, because that would be a totally different formula. But in general, this is a really good early stage formula for a cold with a cough. So sticking with Chinese medical indications, Chen say Sāng Jú Yǐn mulberry leaf and chrysanthemum drink is a relatively mild formula that treats the early stage or mild case of wind warmth syndrome, a condition that is similar to but less severe than wind heat syndrome. So again, both of these are kind of emphasizing early stages. Shen continues, coughing, the prominent symptom of this syndrome arises when the wind warmth factor affects the normal lung qi flow. Since this wind warmth syndrome is mild in nature, the fever and thirst will be slight. So again, everything's kind of slight. History of this formula. So both Scheid et al. And Chen both agree the source for this formula is Wenbing Tiao Bian, or the systematic differentiation of warm pathogen disease by Wu Tong or Wu Ju Tong, written in 1798. And if that sounds a little bit familiar, we just mentioned Wu Ju Tong when we were talking about the Wenbing theory or school of thought. And so he was a major player, major doctor in that school of thought. So this comes directly out of the Wenbing theory, basically. Warm pathogen disease. Let's talk about the ingredients of this formula. So the first ingredient that we're going to talk about is morifolium or Sāng Ye meaning flower, folium meaning flowers. So this is the flowers, or the leaves, actually, excuse me, leaves of the mori tree. So we're using 7.5 grams in this formula. I got to be honest with you, the weights of these herbs are not very standard. They're a little bit off from most of the formulas that we look at. But I think that's to do with that it's using kind of, usually a lot of the formulas are translated from some of the ancient measurements into more modern measurements. And I kind of feel like they did that here, but they did it more exactly than they usually do. And what's interesting is both books did the exact same thing. So so normally we look at 9 grams or 6 grams, and here's 7.5 grams. So I don't know what that's about, but that's this formula. So Sāng comes from the cool acrid herbs that release the exterior category. They disperse and scatter wind heat, calm the liver and clear the eyes, clear the lungs and moisten dryness, and cool the blood and stop bleeding. For this formula, Morium folium Sāng and Chrysanthemum floss Juhua, our next ingredient that we're going to talk about, are the chief herbs. And they are cool and light and can clear heat from the exterior. Morifolium Sāng has a sweet and bitter flavor. It clears heat from the lungs and stops coughing. Chen say Sāng, folium more, and Juhua, floss, chrysanthemum expel the wind warmth factor and clear lung heat. So basically the same thing, the roles of these herbs. So the second herb, which we've already said is the chief herb, is chrysanthemum floss or Juhua. This is chrysanthemum flower. In fact, I was just talking about chrysanthemum flower to my friends last night, because it seemed like when I went over to China, every elderly person you saw was drinking chrysanthemum tea. At least that's what it seemed to me when I was over there, it was 2007, 2008, something around there. So here you're using 3 grams of Juhua, the chrysanthemum chrysanthemum flowers. And those are also from the cool acrid herbs that release the exterior. And they disperse wind and clear heat, calm the liver and clear the eyes, calm the liver and extinguish wind, and resolve toxicity. According to Scheid et al., Chrysanthemum floss Jú Hua disperses upper burner wind heat, including that which affects the eyes. Our third herb is Forsythia fructus lien chow. And here we're using 4.5 grams. And this is from a different category of herbs. This is from the category of herbs that clear heat and resolve toxicity. Clears heat and resolves toxicity and reduces abscesses and dissipates clumps. Two of the deputies, this is a quote from Scheid about this formula, two of the deputies, Forsythia fructus lien chow and Menthe haplocalycis herba boha, strengthen the formula's exterior releasing properties. Lien chow fructus forsythia clears heat and eliminates toxins in the upper jiao, according to Chen and Chen. Our next herb is Menthe haplocalycis herba or boha. This is field mint. I always learned it was peppermint, but then as I did one of these Spurbs herbs on it, I found out it was not peppermint. It is field mint, which is a different species of mint. We're using 2.4 grams here, added near the end of the cooking process. There's a lot of volatile oils in this, so you do not want to cook them off. And it also comes from the cool acrid herbs that release the exterior category of herbs. Traditionally, it clears and benefits the head, eyes, and throat, vents rashes, courses the liver, and moves qi. We already mentioned that it's a deputy herb with, and talked about it with from Scheid, but Chen says, Boha herba menthe helps clear the wind warmth from the upper jiao. So remember the upper jiao, the upper burner is going to be the upper part, including the lungs is really what we're talking about here. We talked about the three burners previously, and we won't get into that too much here. Our next herb is Platycody radix or jiegong. This is from the warm herb that transforms cold phlegm category. So a very different category than we've covered so far. Opens up and it disseminates the lung qi, dispels phlegm and benefits the throat, pushes out pus and opens up and raises the lung qi while also directing the actions of other herbs to the upper regions of the body. So this is really considered very helpful for coughs and phlegm, basically. So here we have two other deputies. This is from Scheid et al. Two other deputies, Platycody radix, jiegong, which has an ascending action, and Armeniaceae semen xing ren. This is peach pit kernel. Maybe it's apricot kernel, which has a descending action, assists the chief herbs by facilitating the flow of lung qi to stop the coughing. And that brings us to that Armeniaceae semen xing ren. We're using 6 grams, and it is in the herbs that relieve coughing and wheezing category. And it stops cough and calms wheezing and moistens the intestines and unblocks the bowels. So it's considered a seed. So all seeds, most seeds anyways, moisten the intestines, unblock the bowels. So that's what's happening here. Our next herb is Phragmites rhizoma or lugen. And this is 6 grams, and this is from the category herbs that drain fire. Clears heat and generates fluids, clears heat and promotes urination, and encourages rashes to surface. And Scheid et al. Says the assistant, Phragmites rhizoma lugen, clears heat and generates fluids, and thereby reducing thirst. Chen say lugen rhizoma phragmites clears heat and promotes the generation of body fluids to relieve thirst. It's almost word for word the same thing. So very, very similar. Anyways, they all have very similar functions here. And our last herb in this formula is Glycericerae radix gansao, which is licorice. And I forgot to change the picture on here. It's picturing Gansao, honey fried, rather than raw gansao. So I'm going to change that picture on this slide later. We're only using 2.4 grams of this herb, and it's from the herbs that tonify the qi. Certainly in this formula may help with the qi, but you're going to see one of the other functions of licorice, and one of the reasons why it's in most formulas, is coming up. So the functions of this include tonifies the spleen and augments the qi, moistens the lungs and stops cough. So that's good for our formula today. Moderates spasms and alleviates pain. Moderates and harmonizes the characteristics of other herbs. That's the function that makes it so commonly used. Glycericerae radix gansao, the envoy, helps clear the heat and harmonizes the actions of the other herbs. Chen Chen say gansao radix et rhizoma glycericerae harmonizes the herbs. And I just want to say, if you are paying really close attention to this, you will find that Scheid has this listed as Glycericerae radix, while Chen and Chen will say radix et rhizoma, which means root and rhizomes, Glycericerae. In other words, the radix is before the species, while Scheid does the species before the part of the plant, the radix. And there was a time where, all the herb books had them, the parts before the name of the plant, so the radix glycericerae. In fact, the previous version of the formulas book had them that way. And then they kind of shifted over, and we've realized that the proper way to do it is to have the part of the plant after the plant name. So it should be Glycericerae radix. That is the more proper way to go. However, Chen Chen has it the other way. I'm quoting them, so I leave it the way they do it. And it's not necessarily wrong to do it the other way. It's just not as proper. So I just kind of wanted to mention out that they will put them on opposite ends. But the way it should be is Glycericerae radix rather than radix glycericerae. Okay, let's talk about preparation of this formula according to Scheid et al. Preparation of this formula is decoction. That's the first word they say. It's just decoction, period. Do not cook for more than 20 minutes, as the source text says to cook down to 1 cup from 2. Because at present drinks, yin, are thought to be most effective when transparent, followers of the warm pathogen disease school commonly cook this formula for only 10 minutes. Again, you're adding that bo he towards the end of that. So commentary, as usual, Scheid et al. Has an excellent commentary about this formula. And here we go, quote, "This is the classic formula for early stage warm pathogen diseases or other mild exterior heat disorders in which coughing is the main symptom. It is also used for eye disorders due to wind heat and hacking cough due to exterior dryness. According to its author Wuju Tang, the famous systematizer of warm pathogen disorder therapeutics, it can address these different disorders because they all require a dispersing formula that releases obstruction in the exterior without injuring the fluids. For this reason, Wu selected as chief herbs Morifolium Sāng Jú Yǐn and Chrysanthemum Floss Ju Hua, a synergistic combination that relies on subtle manipulation of the qi dynamic rather than merely on acrid opening. Morifolium Sāng Jú Yǐn specifically acts on the lung collaterals, which are complicated in the superficial penetration of pathogens into an organ. Both of the chief herbs enter the liver and lung channels. While heat pathogens obstruct the clarifying and downward directing function of the lung qi, the fire of liver yang ascends uncontrolled. By clearing heat from both channels, this formula treats root and branch simultaneously. In addition, both of the chief herbs combine sweet moistening with their clearing and dispersing actions. Chrysanthemum Floss Ju Hua, in particular, protects the fluids, and by gently nourishing the yin, helps to control the excess of yang that is the root of this pathology. This formula may also be used in treating the transitional stage between acute and chronic rhinitis or sinusitis, characterized by mucosal swelling, congestion, and sensitivity to dust and cold drafts. For this reason, some practitioners use the formula as a foundation in formulas that treat allergic rhinitis. Deng Xiaoxian, a prominent modern physician from Chengdu, uses this decoction for chronic pediatric diarrhea with considerable success. It is also very effective for acute stiff neck. Chen and Chen say as a commentary, in this formula, Sāng Jú Yǐn, Folium Mori, and Juhua Floss Chrysanthemum are used as chief herbs to gently disperse early stage wind warmth that is beginning to affect the lung. Although Boha herba mentha is colder and has a stronger exterior releasing effect, it is not suitable as the chief herb for two main reasons. First, its exterior releasing effect is too strong and may further damage body fluids, create heat, phlegm, and aggravate cough. Second, it does not clear lung heat nor arrest the cough. Therefore, Boha herba mentha is not suitable as the chief ingredient, but is used as the deputy herb to help Sāng Jú Yǐn, Folium Mori, and Juhua Floss Chrysanthemum release wind warmth. Chen also say Sāng Jú Yǐn is one of the most essential and effective formulas for treating mild cases of cough caused by wind warmth invasion. This formula is also effective in treating dry cough with scanty or no sputum during the autumn. Because this formula is mild in nature, it is necessary to modify it to increase its potency and or address associated complications. So speaking of that, let's talk about some modifications of this formula. Shai discussed many modifications, including for Qi level dryness, add gypsum fibrosum Shirgao and Anamarena rhizoma germu. Both are very cooling. For nutritive level heat with a dark red tongue, add Scrophularia radix Xuan Shen and Rhinocerotis cornu Shi Jiao. That is rhinoceros horn. That is not something we should be, that's endangered at this point, not easy to get, very expensive, and probably shouldn't use. For heat entering the blood, remove Phragmitis rhizoma lugen and Mentha herba boha, and add Ophiopogonus radix Mymendong, Ramonia radix Shengdiwang, Polygonati adorati, Rhizoma yuju, and Mouton cortex Mudon P. For severe lung heat, add Scutellaria radix Huangqin. For pronounced thirst, add Trichosanthes radix Tianhua Fen. For viscous yellow sputum that is difficult to expectorate, add Trichosanthes pericarpium or Gualo P and Fritillaria thunbergi bulbus Jabei Mu. For labored breathing or slight wheezing, add Gypsum fibrosum Shirgao and Anamarena rhizoma germu. We already actually had that combination for previously for Qi level dryness. So interesting. That's quite an interesting combination to add in here. For blood-streaked sputum, add Mouton cortex, Mudon P, Imperiate, Rhizoma bimalgen, and Nelumbinus nodus rhizomatis, Ouj. For sore throat, and add Lasiosfera calvatia or Mabo, and RTI fructus neobangza. For wind heat affecting the eyes, add Tribuli fructus sigilli, Cassia semen, Jue Mingza, and Prunella spica, Xia Ku Sao. Chen also has several modifications. For severe cough with yellow sputum caused by lung heat, add Huangqin radix scutellaria and Sangbai P cortex mori. For cough with sticky sputum that is difficult to expectorate, add Gualo P, pericarpium trichosanthes, Dongguazi, Semen Benincase, and Zherbei Mu, bulbus Fritillaria thunbergi. For cough with blood-streaked sputum, add bimalgen, Rhizoma imperiate, Huojie, Nodus nelumbinus rhizomatis, and Qiansao radix et Rhizoma rubiae. If there is labored breathing or dyspnea, troubled breathing, characterized by more heat and dryness in the Qi energy level, add Shirgao, Gypsum fibrosum, and Germu, Rhizoma anamarena to clear the lungs. So again, that combination is very common for heat and dryness. Continuing, when there's more thirst, add tianhua, fen, Radius trichosanthes, and germu, Rhizoma anamarena. If accompanied by a sore throat, add Shagan, Rhizoma bellancande, Shandogen, Radix et Rhizoma sophore tonkinensis, and Neobongza, Fructus arctii. For eye disorders caused by wind warmth invasion, add Chan Tui, Periostracum cicada, which we're going to be talking about in our next episode of Spurbs Herbs. For eye disorders caused by liver heat, add Jue Mingza, Semen Cassier, and Jili, Fructus tribuli. All right, comparisons. Scheid and his team has two formulas. It compares to today's formula. Have two formulas. Honeysuckle and forsythia powder, Yin Qiao San. This is one of those, as I said, there's like 3 or 4 formulas if someone's coming down with a cold. This is another very, very commonly used formula for that, Yin Qiao San. So honeysuckle and forsythia powder. While these formulas share many of the same ingredients, mulberry leaf and chrysanthemum drink Sāng Jú Yǐn is lighter in nature and through its effect on the qi dynamic of the lungs, more effective in treating cough. Honeysuckle and forsythia powder Yin Qiao San is a stronger formula for releasing the exterior and clearing heat and is therefore more suitable for the early stage of warm pathogen disorders presenting with fever and sore throat. The other formula is mulberry leaf and apricot kernel decoction, or Sāng Jú Yǐn. Both formulas are based on light, acrid, and sweet moistening herbs. Mulberry leaf and chrysanthemum drink Sāng Jú Yǐn is used to treat early stage wind heat disorders, invading the lung collaterals that present with fever, headaches, and coughing. Compared to a mulberry leaf and apricot kernel decoction, Sāng Jú Yǐn pattern, the fever and other heat symptoms will tend to be more pronounced and the development more rapid due to the presence of wind. For this reason, the formula combines sweet, moistening herbs with a large number of light, acrid, and cooling herbs that clear heat and disperse wind. Chen also compare these two formulas to Sāng Jú Yǐn, so exact same 2 formulas. They say Yin Qiao San honeysuckle and forsythia powder and Sāng Jú Yǐn are cool, acrid formulas used for the initial stages of warm febrile disorders. Both contain Lian Chao, Fructus forsythiae, Jie Gong, Radix platyconus, Gan Sao, Radix et Rhizoma glycericerae, Bo He, Herba menthae, and Lu Gan, Rhizoma phragmitis. Yin Qiao San has stronger heat clearing and exterior releasing effects. Sāng Jú Yǐn more effectively ventilates the lung to arrest coughing. They continue with Sāng Jú Yǐn, mulberry leaf and apricot kernel decoction, and Sāng Jú Yǐn. Both contain Ku Xing Ren, or Semen Amarnaceae amarum, and Sāng Ye, Folium Mori, to clear the heat, relieve cough, and expel exterior factors. Sāng Jú Yǐn is indicated for dryness and heat attacking the lung. This formula contains moistening herbs such as Sha Shen, Radix glenia su adeniferae, and Jia Bei Mu, bulbous fritillaria thunbergi, to treat dryness symptoms. Sāng Jú Yǐn is indicated for wind warmth attacking the lung. It contains heat clearing herbs such as Bo He, Herba menthae, Lu Gan, Rhizoma phragmitis, and Lian Chao, Fructus forsythia, to clear heat. What are the biomedical indications for these formula? Scheid and his team say, with the appropriate presentation, this formula may be used to treat a variety of biomedically defined disorders, primarily involving acute respiratory tract infections, including the common cold, influenza, bronchitis, pneumonia, tonsillitis, and conjunctivitis. Chen say this formula has many pharmacological effects, including being antipyretic, so reduces fever, and anti-inflammatory, based on rabbit and mice studies. Let's talk about the science. Chen lists several clinical studies with positive findings involving this formula. Treating upper respiratory tract infections, or URTIs, in 375 patients, so that's a fairly well-powered study. Treating cough in 80 pediatric patients with modifications to the base formula, adding mahuang herba ephedra, which we really can't get in the US anymore in most developed countries, and ganjiang, Rhizoma zingiberis, as well as specific modifications based on certain signs and symptoms. Another modified version was studied for treating influenza 150 patients. So remember, when we look at the number of patients, 30 to 40 are necessary in order to be able to apply population statistics to a study. So 50 is there, it's over that 30 to 40, but it's not much above this. It's still relatively low powered, but it's definitely enough to do some statistics. And same with this, another study of 60 patients used a modified version of this formula for treating epistaxis, which is nose bleeding. So that's an interesting use of this formula. There were a couple of clinical review studies involving Sāng Jú Yǐn discussed the combination of Sāng Jú Yǐn and Yu Ping Fang San jade windscreen powder and helping resistance to COVID-19. So that's an interesting thing. They were actually using that prophylactically to build resistance to COVID-19. Another study showed the efficacy of Sāng Jú Yǐn treating Mycoplasma pneumoniae infection in a retrospective study with 150 patients. So mycoplasmas are generally a little bit more difficult to treat bacteria. And first of all, retrospective studies are not, we generally want prospective studies rather than retrospective studies. Not that we can't learn from retrospective studies, but they're not as strong as prospective studies. And 150 patients, well, that sounds like a lot more than that 30 to 40 that I was talking about. When you're talking about a retrospective study, that's not many. I mean, most retrospective studies I see, even in Chinese medicine, are using thousands of patients. So 150 patients is not a lot for a retrospective study. And so generally, I would say this is not a very strong study, but it's an interesting one. Let's look at drug-herb interactions. A few herbs in this formula may present some risks for drug-herb interactions. Glycerol radix consal may induce cytochrome P450, 2C19, and 3A4. 3A4 being the most common cytochrome P450 utilized by drugs. What this does is increase the risk of drug-herb interactions. And if you want to know more about cytochrome P450s, I have courses for that. But this is a main risk factor for it. A rat study, so I generally don't like talking about rat studies. It should be clinical studies, but when all we have are animal studies or even bench research, we should know about it for increased risk of drug-herb interaction. So a rat study showed induction of cytochrome P450 1A2 and 2C6 and an inhibition of 2A3 and 3A1 when given herbs in Sāng Jú Yǐn, mulberry leaf, and chrysanthemum drink. So 1A2 is fairly common of those. The other three are not very commonly used cytochrome P450s. Let's talk about some concerns about this formula. So Scheid et al. Did not have any cautions or concerns about this formula at all. That's a rarity. However, Chen and Chen do. Under the heading of cautions, contraindications, they say Sāng Jú Yǐn is an acrid and cold formula that treats wind warmth condition. It is inappropriate for cough caused by wind cold. This formula has only mild potency to treat cough caused by wind warmth invasion. Cases of severe cough caused by lung heat, the use of this formula alone will not be sufficient. Modification with additional herbs and doses or selection of another formula is necessary for proper treatment. And that's it for our formula today. That was today's formula. Sāng Jú Yǐn or mulberry leaf and chrysanthemum drink, a useful formula for treating colds or external attacks with a cough. Started by introducing the necessity for mandatory reporting, and then we got into the formula, including its ingredients, commentary, the science, our concerns and cautions, as well as its potential drug interactions. All in all, another exploration of a fascinating and useful Chinese formula. Quite well, commonly used formula. In 2 weeks, we are going to be looking at another single Chinese herb, Chan Tui. I kind of hinted at that earlier. Cicada periostracum or cicada molting. This herb is in the Chinese medical subcategory of herbs that cool and release the exterior. Has several interesting functions such as venting rashes, clearing the eyes, and stopping spasms. As usual, we will explore all the intricacies of this herb, as well as an explanation of its category. And as always, we will look at something a little different. Join us in 2 weeks for another interesting episode. And I'd like to say thank you very much for listening. If you like this podcast, please do us a favor, a huge favor, subscribe to our podcast in your favorite podcast app. We thank you for even considering doing that. Remember, you can get CU's, Continuing Education Units, and National Certification Commission of Acupuncture and Oriental Medicine professional development activities at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. And don't forget that 20% off with the code SH20OFF. That's all of the courses that you buy at one time can get 20% off. So SH20OFF. And you can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. And as usual, we have quite bibliography. Thank you.
Spurbs Herbs. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy
Nick
Dobbins,
Rogers.
Campbell.